Hello, my name is Tori Samuel, and I live in Ocala, Florida, and I'm 43 years old, and I have been living with HIV for 23 years. I am a wife and mother of three biological children. I have been with my husband. We've been married. It will be 16 years this coming March the 7th, 2026. And my children are ages 22, and I have a set of twins that are 12. My husband or my kids are not living with HIV. And this is because I am virally suppressed, undetectable, which means that the HIV is so low in my blood that it can't be detected by a blood test. I am a Florida HIV advocate, and I try to break stigma surrounding the HIV health condition and also bring awareness around the HIV health condition, that this is not a death sentence, that you can live a healthy, thriving, successful life. As long as we take our medicines, we'll be fine. And that's what I do. I just try to be a voice for people that's living with this health condition that may not be open about their status, or just someone who's just not vocal for whatever reason surrounding this health condition. I just try to be a voice for my people. I just wanted to talk about the upcoming changes to the ADAP program. ADAP stands for the AIDS Drug Assistance Program. Changes to this program that would affect the eligibility requirements for this program. And also, it will not cover the premiums for the insurance payments to cover people's medications. It would also affect Biktarvy. It would take Biktarvy off of the formulary, and Biktarvy is an HIV medication that I currently take, and a lot of other people here in Florida take this medication. So this would be a drastic, terrible, terrible thing to happen. I have been advocating against this ADAP program changes. I have went down to Broward County, and we did rally at the Fort Lauderdale Health Department trying to bring awareness against this. I've shared my story. Went front page on the Washington Post. Just recently, last week, I was able to go up to Tallahassee to the Capitol to share my story and advocate against the ADAP program changes. I was able to speak to lawmakers and just really bring awareness surrounding what the ADAP program changes, how it would affect me and 16,000 other Floridians here in Florida. Um, and it's just been amazing to just see the progress, what we're doing, and just having the boots on the ground and just be able to share my story and let people know how important the ADAP program is to people living with this health condition. And I just want to speak on the devastating impact these ADAP program changes would be on me and 16,000 other Floridians living here in Florida. We will not have access to our medications. We don't know how we're going to be able to get our medications. And that's scary. I've I'm sitting here trying to figure out, what am I going to do? What will I do not being able to have access to the medication that has helped me for 8 years stay virally suppressed with no side effects? It's scary. And I just keep trying to wrap my mind around what's going to happen. So we have to really stand together and advocate against this, because this can't happen. My life and 16,000 other Floridians' lives are at stake here, and we just can't allow this to happen. I just want to start off with my people living with HIV, with this health condition. Start by reaching out to your case managers, reaching out to your healthcare provider, and see if you can possibly get your healthcare provider to write you a 90-day script to hold you over till we can see what's going on. Um, and also reach out to, people in the different communities, PWN, different organizations could possibly help you. For others that are not living with HIV and people still living with HIV, you can submit a public comment. Please submit these comments. They have to be submitted by March the 4th. And like I said, you can just, express your, disagreement with these ADAP program changes. Um, And like I said, please follow PWN on social media and YouTube so we can continue to bring awareness to what's going on with the ADAP and continue to advocate against these ADAP program changes, because our voice together, we are powerful. If we're not together, we are powerless. So please, everybody, do your part right now and let's advocate to stop these ADAP program changes.